We in the United States have the best physicians and clinical staff in the world. But the challenge is getting folks to work together.
Aetna came forward very early in our journey and indicated that they wanted to participate in improving the quality of care.
Memorial Hermann is one of the leading healthcare systems in the country. With that kind of marriage, we've been able to take the best practices from both sides, have an open mind on how we really deliver the care.
We keep the consumer and the member top of mind in our collaboration with providers.
We've really reimagined the way that we should be delivering healthcare. We've changed the concept to be health management. In the new world, we're taking a holistic approach to our patients, which is really exciting. We get to look at not only when they're sick, but we get to help prevent them from getting sick. Care should be team-focused. It should be patient-focused.
A health coach may be deployed, diabetic educator, pharmacist.
We have case managers who are clinical staff and social workers that will help.
They can help the patient navigate the system, coordinate the care for them, working with their providers and their physicians to make sure that everybody understands what's going on.
We're doing member outreach, care outreach, and making sure that we're keeping the member at the center of our care management efforts.
It can be as simple as follow-up calls from the physician's office that motivates a member to be active in the management of their own health.
Patients that have received this care have been very excited. They've been very grateful. Some folks have always believed that if you improve the quality, the cost will have to go up with it, and vice versa. And I think they actually go hand in hand.
The redesign of the care delivery model between us and Aetna allows us to reduce cost and improve the quality of care.
We're able to do that with the collaborative work we do with clinical models, with how healthcare is delivered, and specifically by reducing inefficiencies in the system.
If we do what's right for the patient, if we apply care management, case management, we do member outreach, naturally we will improve the quality for the patient. As we improve the quality for the patient, we do fewer tests. We're more seamless in terms of how we manage the patient. We find that the cost naturally reduces. We've demonstrated in a number of different circumstances we've been able to do exactly that.
There are fewer infections, there are fewer complications, there's a lowered readmission rate.
That's how we can get really high quality while decreasing the cost.
We have all the information we've collected on the hospital side, married to the information that Aetna brings to the table, allows us to look at the complete disease process for a patient.
We work together on aspects such as data and analytics to understand what's going on at an individual patient level, at a health system level, and across communities as well.
We both have key parts of the equation. We know what's happened to that patient inside of our hospitals and ambulatory and imaging sites. Aetna knows a whole lot about what happens to them when they're outside of our viewpoint. When we put those two together, we get a more complete and longitudinal view of the patient, and we're much better able to intervene with care and case management.
At the point of care, it's your visit. I know exactly what you need at that time.
That's the power of the information that we can pull together in working with providers collaboratively.
Our primary care physicians now can see all the information that they need to take care of folks. They can keep folks healthy before they get sick.
If we have lab data that shows that your blood sugar has been trending higher, why not intervene and deploy resources at that point?
Employers are always looking for a differentiated experience for their employees and their dependents. They want high-quality care at a lower cost.
By improving the coordination of care between Aetna and Memorial Hermann, we've been able to reduce the costs that are paid both by employees and employers.
From an employer perspective, I think that translates down the road to happy employees, engaged employees, and productive employees. And I think those things are really key. We're at a time where we can start to put the pieces of the puzzle together.
It's an exciting time to be in healthcare with the transformation that's happening. And it's all driven toward better outcomes for the patient.
We're just scratching the surface, and there's more opportunity from here.
Every day I wake up and I'm excited to come to work. I know we're making a difference.